I'm going to be palpating here for the femoral. You got that? Yep. Oh, so perfect. Yep, we're good. So we're going to get the, I always palpate for the femoral nerve, artery, and vein when I'm doing this under fluoroscopy, because that's the zone that you want to make sure you're missing. So we're going to stay lateral to that. And this would be the same approach with the ultrasound. So I got a good pulse, or the femoral pulse here. So I'm going to be placing holding the clamp over here laterally. And so I'm going to be going for that upper outer quadrant of the femoral head with my injection. So this here is going to be way outside. So the femoral artery, nerve, and vein are way over here. And I'm going to be coming with my needle approach laterally over here. So perfect. Even cold spray that. This is going to be the anesthetic. A bit little pinch. 1, 2, 3, and pinch. Got a skin wheel there. A little anesthetic downbeat. Right there. I'm at the joint capsule, so I made engagement with the ligament, so I know I need to go a little bit deeper, so you might feel a little pressure as I push through that joint capsule right there. And then the joint space there. I have his cells. And then you're going to feel a little pressure here. This means and the needle is out, and we are done with the hip. So I always go through and I will palpate again for the femoral artery, nerve, and vein. So you feel that pulsatile effect, but you're going to actually be able to visualize the neurovascular bundle here, the Sonogram. So to come here, there's a good look at the femoral head. So I'm going to scan medially so we could get that neurovascular bundle. So you could see that pulsating artery right there. So it's good to palpate and visualize. So then I come back laterally. So all of that is medial to the screen. So it's out of my field of view and out of my trajectory. So I'm now going to go, this here position is in anatomic transverse. So I'm going to rotate this to an oblique view. So I can get the good look at the head and neck junction there. And there's my target. So looking at the screen going from left to right, you see the femoral head. And then that's, I always call it the ski slope of that head and neck junction here. So, and that's where our target's going to be. And you could see the extension of the capsule coming around the head and down, extending distally down the neck. So there we go. We see that here. We're going to do some cold spray to anesthetize the skin. Very perfect. You'll feel a little pinch. 1, 2, 3, and pinch. And you're going to get a little sting here. You're going to just slowly advance that needle under the sonogram for guidance. Okay, slowly anesthetizing down. I'm going to stop right about there. And get that. Just to take this off here. We got the cells crept. So I'm going to come back and get that back into view. So I can get the needle down. I don't like to anesthetize where I'm placing the cells. So all the way down there. So I'm at that head and neck junction. So you could see where I'm tapping that head neck junction on the screen here. So you could see that needle tip right there. So I'm in that capsule, and then when I'm injecting, we're going to see distension of that fluid in that capsule here. So you could see that traveling up and that space right at that head neck junction filling up, and you could see that right there. So you would see those changes there, and the rear is successfully in the joint.